couple of weeks ago, while I was taking a shower, I noticed a lump. Who do I see? A family practitioner, an OBGYN, or a specialist?
Welcome to the premiere episode of Health in Today's Woman. That is a great question. In my practice, we often see patients that present after finding a lump in their breast in the shower. This can be a very intimidating experience, and patients often want to know, where do I go from here? Well, we're very lucky today to have two well-known breast surgeons from the Murfreesboro Medical Clinic, Dr. Rebecca Baskin and Dr. Jimmy Carter. Rebecca, where does the patient go from here?
Well, the first thing to do as quickly as possible is to call their physician, and that can be any of those physicians that she mentioned. And originally, you just need to meet them and get the further workup that's needed. And that usually starts with a mammogram. And if someone is feeling something that's new, that usually starts with what is called a diagnostic mammogram, so that they can take all the films that are needed at that time. If she's over 30, if she's under 30, it will often start with an ultrasound. If that woman is over 30, then an ultrasound may be added to the mammogram to help them distinguish exactly what they're seeing, if anything, on the mammogram.
And can any of those physicians order that, or do they need to be going to a specialist to be able to get those tests ordered?
Any of those physicians can actually order that test. Depending on what their comfort level is, they may then, if something is found or if they're concerned about something that they're feeling but there's nothing on any of the films, then they will often refer to a specialist, a general surgeon, or a breast surgeon at that point.
And Jimmy, one of the things that I think is important here is also, when they do get to the doctor, what kind of things do they need to mention to you as the patient to begin to kind of have an idea of making your job a little bit easier?
Well, I think any woman that initially reaches up and feels a lump in her breast, the most important thing is to go to the doctor, to the nurse practitioner, and initiate a workup, get something going. One of the things I've noticed over the many years in practice of breast disease is that women will become so fearful when they feel a lump that they'll try to push it back in their mind. They want to basically not hear that there's something in their breast from a doctor, because I think my experience has been that a woman initially, when she feels something in her breast, convinces herself that she has a cancer. Well, fortunately, 80% of new masses in the breast are not cancer. The other things, once she does get to the doctor or the nurse practitioner and the workup begins and she begins a dialogue with her doctor, it's very important to know about family history. Okay. It's very important to know whether or not she's had previous breast problems, particularly if she's had previous breast cancer or that kind of thing.
Go ahead, Rebecca.
I was going to say also, she might have noticed, depending on how long she takes to address it, has this changed in shape or size? A lot of things we see are actually due to benign issues that may be even fibrocystic, and if this changes in size and gets bigger before the menstrual cycle and smaller afterwards, that's actually very diagnostic in itself and is a good sign, and that's something important to know up front. And really encourage women to remember what he said about the majority of things, over 80% that we biopsy, are benign. So most of the time we can get that woman peace of mind and get it quickly if she will just go ahead and address the problem. And
one of the things I think is really important that you mentioned is discussion. You need to initiate discussion, and that's something that I think is really important that we communicate to women, is this is a discussion, that you really need to go in with this information, but you need to it's a give and take situation where you need to give the doctor information, but you also need to be a part of that discussion and feel like you are actually having something to say in the situation. Do y'all agree?
I certainly agree with that, and I think one of the things that we like to emphasize in our practice is a relationship between the doctor and the patient, or the nurse practitioner and the patient. I don't want to leave that important group of people out, but I think at the opening of this segment, you mentioned one of the problems with modern healthcare. One of the problems with modern healthcare is many of us now have electronics in our office, like computers, and what we would like to do is interface with the patient when the patient is in front of us and not interface with the computer. If you're if your healthcare provider is not listening to you, get to somebody who will listen to you and do what you've mentioned, which is a dialogue, a give and a take, and make sure that all the components of the history and the family history and the past history are part of that discussion, and not leaping over the practitioner's head because he or she's too busy at the computer console.
That is a great point, and I noticed that even in my own practice, that it's so important not to bring in stuff. And different doctors have different personalities, and believe me, there is no such thing as a great personality or the perfect one. Every doctor's different. One of the things that I do find in my own practice is I have a lot of patients that come in and say, Dr. Williams, you've told me how to find a lump and you've told me how to do it, but I got lumpy, bumpy breasts. How can those patients determine what's a lump that's concerning versus a lump that, I may not need to go to the doctor? Or is there such a scenario where they don't need to go to the doctor?
Well, I think for the most part, there are a lot of women that have lumpy, bumpy breasts, and that goes along with something we talked about earlier, which is fibrocystic. But I think if a woman is comfortable doing her breast exam and can do her breast exam, she's going to notice when there is a new lump, especially a lump that doesn't go away after a month or two of her menstrual cycles. That is absolutely something that needs to be addressed. It needs to be worked up radiologically. It needs to be palpated by a physician or a medical expert, and then worked forward. Does that need a biopsy or not need a biopsy? So oftentimes women will find their own new lumps. There are some women that are so lumpy and bumpy and they get very scared doing their exams. Then they need to get a good working relationship with their physician and let their physician do those exams, whether that's once a year or twice a year, whatever makes her comfortable, to make sure that something doesn't get missed.
I would add to that, in line with what you mentioned about how can they differentiate or tell the difference between a good lump, or a quote-unquote good lump, and a bad lump. That's really something that I wouldn't want the patient to be fearful about or worry about. As a matter of fact, I wouldn't want the primary care physician to worry about that. I want the differentiation, or the ability to tell whether a lump is good or bad, to fall under the care that I would render.
Right.
Because over the years, to tell the difference between a good lump and a bad lump is a very difficult thing, and I wouldn't want the patient to take the burden of that, nor would I want the primary care physician to take the burden of that.
We have had some great discussion, but we need to take a break here. When we come back, we'll be visiting the Murfreesboro Medical Clinic's Comprehensive Breast Center at their new facility in Murfreesboro, Tennessee.